Hi, I'm Barbara Husser, and today we're going to be doing a family assessment for class Nursing 332. This family assessment was conducted using the Friedman's Family Assessment Model. This model was created by Marilyn Friedman. It views the family as subsystems of society, includes religion, education, and health. It can help highlight strengths and weaknesses of the family. Identifying data for this family, the Smith family consists of mom Ashley, dad Robert. Together they have a blended family of 4 children, Todd, Nick, Elizabeth, Daniel, and Kip. Robert had Todd, Daniel, and Kip with the previous marriage, and Ashley had 2 children of her own, Nick and Elizabeth, with her previous marriage. They are a Christian Caucasian family that speaks English. Church is a very large part of their life. Sundays are dedicated that the family goes to church and spends time together after. They are a lower middle class family with both parents working full time. Robert is in the military and Ashley is a nurse at the local hospital and works night shift 3 to 4 days a week. This is the genogram of the family. So Robert and Ashley are the main parents. Ashley's parents are Mary and Thomas. Mary in the past has suffered from TIAs. She has hypertension, a diagnosis of lupus, and a cognitive disorder. She was diagnosed with early onset dementia at age 48. Thomas has diabetes and hypertension. Robert's parents are Denise and John. Denise has hypertension, is obese, has diabetes, and John has heart disease, is obese, and has diabetes as well. Robert has 3 other siblings, Rebecca, Dylan, and Julie. Dylan has bipolar disorder, and Julie has hypertension. Rebecca has a history of drug abuse and mental health disorders. She was also diagnosed with bipolar. Robert has arthritis and hypertension and is obese. Ashley suffers from anxiety, has ADD. Ashley has a brother, Richard, who was diagnosed with high functioning autism at a young age and has lived a successful life. Robert's 3 children, Todd, Kip, and Daniel, do not have any significant medical history, while Nick was diagnosed with Asperger's at the age of 6 and ADHD, and it has not truly interfered with his life. He goes to a therapist, but he was able to graduate high school and is successfully enrolled in college. Elizabeth will be soon graduating high school. She has a diagnosis of anxiety and arthritis. Her anxiety does play a large part of her life. The eco map of this family's dynamic. So as the family unit, we have Ashley, Robert, Elizabeth, Nick, Daniel, Todd, and Kip. Mental health services are a large part of their life because of Ashley's anxiety, Elizabeth's anxiety, and Nick having ADHD and Asperger's. This can create a stressful situation, but they try to stay on top of their mental health services with therapists and psychiatrists and try to keep an open communication with the family as to how they're feeling. They have a moderate connection with healthcare providers as they do regularly keep up with their appointments and scheduled follow-ups. Robert and Ashley make a pretty decent living, so work and finances is a strong connection that is not an added stressor in their life. church and their family, they do have a moderate connection. Like I said, they are very involved in their church. The children do sports and activities. Nick has played soccer and tennis for school. Elizabeth has done soccer and volleyball, plays for school, outside recreational teams and club teams. That seems to help with her anxiety and gives her a good coping strategy there. Daniel, Todd, and Kip have played various recreational sports, but not solely devoted to any particular sport. The developmental level of this family, based on the Duvall's family developmental model, would be stage 5, the teenage years. The family has 4 children at home, with the oldest being 20 years old. The 20-year-old is not quite out of the home yet, as they are still attending college and have not moved out yet. The primary focus during this stage is maintaining an open communication between the family and the children, and Ashley and Robert maintaining a great marital relationship, which they have done so well with their blended family. The family lives in a middle-class 4-bedroom, 3-bath house on a nice-sized piece of property on a dead-end, quiet street that they do own. They have adequate financial resources to keep up the house. They have access to water, heat, electricity, and food. In their community, they have everything that they need for healthcare agencies, employment. The kids are in public school, but it has been no issue with their education. They also have access to mental health facilities. They see therapists and psychiatrists there. In the healthcare portion of the family's functions, the family defines health and illness. Illness is something that would interfere in their daily life. Long-term illness being something that they're chronically dealing with. Short-term is just the common cold, flu, stomach virus, to which they can see a physician for. But they define being healthy as something that is not taking over their life, and they can still have a good quality of life doing their daily activities. They routinely follow up with their primary care doctor, and they continue all of their follow-up. The family eats primarily healthy, but Southern overall. Lots of carbs, rice, pastas. This does take an effect with Robert, as he does have hypertension and is obese, so he just tries to portion his food. Sleeping habits of the family. Ashley is a nighttime hospital nurse, so her sleep is not as adequate as it should be, but habits of the rest of the family get an adequate night's sleep to go on with their school and work activities. The family recreationally, they like to go to the beach, they boat together. Overall, they try to spend time together. As the children are getting older, they have their own activities and lives, but they still try to commit that time together when possible. The family all does go to the dentist every 6 months. They keep that in check, so they have no dental issues there. With the family's health history of other family members, diabetes is a large concern. Mental health is a large concern with so many mental disorders diagnosed in the family. That is something that they stay in touch with and keep open communication about their feelings and how that is affecting them in their daily life. As far as stress factors, of course, mental health is a large stress factor in this family. Ashley and Elizabeth suffers from anxiety, and Nick suffering from ADHD. All of them are adequately controlled with therapy and medications. Elizabeth did have a period where her mental health was affecting her more so than it is now, and she was able to get on a medication for that and is much better controlled. Short-term stressors is just the daily life of all of the children, their schedules, activities, Ashley's work schedule, the basic routines of cleaning the home, cooking dinner, all of that, but the family together handles that well. They have open communication, share a schedule on who needs to do what on what days. Dysfunctional coping strategies that the family has experienced in the past. Again, it's with mental health. Elizabeth, when she was suffering with her mental health more so, she was extremely depressed and it kind of took a toll on the whole family. But using new coping strategies given by her therapist, she has been able to control that. Nursing diagnosis for this family, since mental health is such a large part of their family, is risk for impaired mental health related to a strong family history of mental health disorders, neurodevelopmental conditions, and substance use, as evidenced by diagnosed depression, bipolar disorder, anxiety, ADHD, ADD, and autism spectrum disorders, and substance abuse among multiple family members. The expected outcome that we are looking for is that the family will demonstrate increased awareness, early identification, and appropriate use of mental health resources within 6 months, as evidenced by verbalization of coping strategies, reduced stigma towards mental health treatment, and engagement with mental health or behavioral health services when indicated. A nursing care plan for this family is to educate them on the common signs and symptoms of depression, bipolar disorder, anxiety, and substance use disorders, all being in tune together to notice when another family member is not doing so well and what can we do to help them. They are aware of the importance of early identification and treatment, and medication adherence and potential side effects would be discussed. Elizabeth being on medication and adhering to her medication is extremely important, as so she does not go into a deep depression again, and we will provide education on stress management techniques. Psychosocial and support for the family is encouraging developmental of healthy coping mechanisms and communication within the family, promote participation in family therapy and support groups, and encourage parents and caregivers to model positive coping behaviors for the younger family members. Our Healthy People objective is MHMD01, reduce the suicide rate, as depression and mental health disorders has a higher rate of suicide. So that would be relevant to this family assessment.